Your heart is the main organ of your cardiovascular system, a network of blood vessels that pumps blood throughout your body. The cardiothoracic surgery program at Boulder Community Health's Foothills Hospital is on the forefront of heart health and surgery. We spoke with Director of Cardiovascular Surgery at BCH and board-certified cardiovascular surgeon Dr. Daniel O'Hare to learn more about this state-of-the-art program.
Boulder Community Health and Foothills Hospital delivers excellence in cardiac surgery every single day. We have 3 of the most experienced surgeons in the state, and when it comes to mitral valve repair or replacement, we have the largest program in the 5-state area. We are doing mitral valve surgery, mitral valve repair, mitral valve replacement through tiny incisions, 2 inches or less, and those patients make a rapid recovery. Most of our patients go home on the 2nd day after surgery. We have a 97% repair rate of success. And when those patients come back to see us, well, they always remark how quick their recovery was. One of the things that I think sets Boulder apart is we have a community where people often travel. They often have the means to go to other places around the country. And we see people who feel compelled to go to Mayo or to the Cleveland Clinic, and then they come back home and get a visit here, and almost every single time they stay here because we offer the exact same surgical services that are offered in the largest institutions. So there's something I'm extremely proud of. Our data is as good or better than anyone in the country. We present at national meetings, we publish our data, and we're happy to share it with patients when they come to visit.
February is American Heart Month, a time to raise awareness about heart disease and how to prevent it. With over 20 years of experience, Dr. Daniel O'Hare is one of the nation's leading experts in robotic-assisted mitral valve repair.
The great advantage of robotics is it offers a very precise way to operate inside the patient's body and inside the heart without making the large incisions that are typically necessary to put your hands in or put instruments in. We can do this all through small 7mm ports. There's really no bones cut. And the recovery is very quick. It results in less blood transfusions, less rehospitalization, less heart rhythm disturbances, and again, a rapid recovery so people can get back to work in an active lifestyle that we enjoy here in Colorado.
The highly experienced cardiologists and surgeons at the cardiothoracic surgery program at Boulder Community Health build lasting personal relationships with each patient. They are the Boulder Valley's only full-service cardiology program, providing everything from diagnostic testing to the latest advanced treatments, including robotic-assisted mitral valve repair.